All right, so part two, continuing with diabetes. We're going to talk about now hyperglycemia and hypoglycemia. I'm going to throw in there what happens with alcohol consumption as well, just because it goes along. You could confuse that patient as a diabetic, and actually the management and treatment of that patient will be very similar to that of a diabetic, with the exception of maybe one thing. In hyperglycemia, let me explain hyperglycemia. A lot of people may be wondering why it is that hyperglycemia, you could still get a condition called diabetic ketoacidosis. Okay, ketones are basically a production of the breakdown of triglycerides. Okay, triglycerides in the liver can be broken down into ketones, and these ketones are used by our cells to yield ATP, okay? Yielding ATP, which is basically energy in life itself. Every cell is going to need ATP, and that's going to balance the sodium-potassium pump, which basically drives the cell cycle. Basically, the life of every single cell in our body depends on this ATP because of the gradient of particles negatively and positively charged in and out, pushing things away from each other. It forms a flow of other things within the cell, and we'll get into a cellular biology in another video where I will explain the very details of the function of our cells, how the majority of our cells function, so we could understand how ATP works, so we could understand how our metabolism works, so we could understand how receptors work and how they respond to certain medications, norepinephrine, and other drugs that we use. So for now, we're going to say that glucose yields ATP, and we're going to leave it at that. If you don't have glucose and the metabolism of glucose, we also have other means. The metabolism of fatty acids into ketones. Okay, that happens to you right now, even if you're a healthy individual. The thing is that since you have a normal pancreas and you have a normal metabolism, okay, your glucose is maintained at a normal level. Your insulin is working. Your receptors are working fine for insulin. So your cells use the majority of the glucose in the circulation, how they should. You still have some ketone production, because when you go to sleep at nighttime, you're fasting for a while. You know, say you come home late from work, you're tired, and maybe you don't eat dinner and you just go to sleep and you crash for 10 hours. You're going to have a lower glucose metabolism and a higher ketone metabolism. Let's say that you eat a healthy dinner and you go to sleep at night and you only sleep 6-7 hours. Well, guess what? You're still going to have a lower glucose metabolism and a higher fatty acid metabolism. So the breakdown of fatty acids into ketones takes place always. Okay, it's not a bad thing. It's a bad thing when it's to an extreme. When you have no glucose intake into the cell, okay, you could be hyperglycemic or hypoglycemic. Both of them can cause ketoacidosis. Let me explain. If you're insulin dependent and you just ate a meal, but you didn't take enough insulin or any insulin at all, or if you're not insulin dependent, but you take oral hypoglycemic drugs, okay, like metformin, let's say, but you did not supplement with insulin or any oral medication, and you just went out and ate ice cream, a rich high carbohydrate food, your glucose is going to spike in your blood, as we mentioned earlier, okay? You're going to have a high glucose level in your blood. In a normal individual, this glucose will eventually, within an hour, be brought down to normal levels, okay? Why is it brought down? Because your cells are responding to insulin and they're absorbing a lot of this glucose, okay? What happens when you need insulin or any other drugs to help your cells take in glucose and you forget to take your medication, but you just ate? What happens is that your cells are not absorbing the amount of glucose that they should. They may be absorbing some, but clinically it's not significant. Okay, it's significant enough to maybe keep you alive, but you're definitely going to be feeling bad. So what happens is that you have hyperglycemia. Your blood level could come out, your patient's blood level can come back at 600, and you're like, wow, this patient has a lot of glucose. But just remember that the cells aren't using it. Okay, even though they have a lot of glucose, their cells are not absorbing it, which is why it's so high to begin with. Okay, what happens is that these cells starve. And these cells starving throughout your body, this could be a heart cell, brain cell, it could be a a musculoskeletal cell. All the cells in the bodies act in the same manner. Most of them. The brain, the GI, and the pancreas don't really need insulin the way that other cells do. Okay, they act a little different, and we'll get into that in another video. So what happens is that you're hyperglycemic, but you haven't taken your medication. So your cells aren't absorbing this. Your liver is going to break down fat into ketones. Okay. Now we also convert protein into a form of into glucose and a form of energy for the cells to use. But right now we're concentrating on ketones. Okay. So what happens is that as these ketones build up, they enter the cells and they're used in the formation of ATP. They're used to make ATP, but this process is a lot longer than the process of glycolysis. Okay, so a ketone state can only sustain you for so long. Okay, a ketone state can sustain you, but only for so long. It's not going to be able to sustain you throughout the day. It's not going to be able to sustain you if you are a diabetic and you do depend on insulin or some type of oral medication. Ketoacidotic state will not maintain you for long. Okay, you always need a combination of glucose metabolism and ketone metabolism. Okay, glucose should be the primary always. Glucose should be the primary, and ketone should be always kept at a minimal level. Okay, in hypoglycemia, what happens is that it's just obvious. Maybe you took your insulin, but you didn't eat. Okay. Maybe you ate a nice little salad real quick because you were in a hurry, and you took your insulin by mistake. You took a little bit higher dose than normal. Okay, you're supposed to take, let's say, 20 units, and you took maybe only 2 units, or you just under-medicated. Okay, or maybe you took your oral hypoglycemic medication, but you just didn't eat. You didn't eat enough. What happens is that now your receptors are working, so you are taking in glucose into your cell. But what happens? You become hypoglycemic. So eventually, initially it may be all right, but eventually after some time, every single cell is going to run out of that glucose and they're going to be taking more. So you're going to become hypoglycemic. And certain cells, especially your brain, in hypoglycemia, your brain is going to be number one. Okay, in hyperglycemia, your brain can tolerate it a little bit longer. But in hypoglycemia, you'll notice neurological symptoms right away. Okay. What happens? Your body also starts breaking down ketones. Okay. Now you'll notice that most ketoacidotic patients that come into the ER or get hospitalized are usually because of hyperglycemia. Because in hypoglycemia, a lot of times they could easily pass out, and unfortunately sometimes they do die. Okay. So this is a process of ketone formation. All right. Ketoacidosis is the liver breaking down fats into ketones for energy. Okay, they could sustain us for a while. They could sustain your brain for a while. But once the glucose runs too low to where there's no glucose at all, I mean, we're talking about maybe your glucose levels down to 20 or even lower, then the ketones, no matter how many ketones you have in your body, which you will produce a lot, they can't sustain you. Okay, we always need glucose no matter what. Ketones only help temporarily. Okay, now let's get into alcohol real quick. Okay. Alcohol inhibits the release of glucose from the liver. Okay, aside from mixing proteins and causing scarring over a long periods of time and depleting things like glutathione and other antioxidants, they block glucagon. They don't block glucagon. They block glucose release from the liver. Okay, yes, your glucagon will go up because your glucose will be low. But it doesn't matter how much glucagon you release. If you still keep on drinking and drinking and drinking, and you haven't really eaten that much food, and you're not eating while you drink. In other words, if you go out drinking, go ahead and have some sugar. Okay, you might not see this. But if you're drinking, and you haven't eaten anything in a while, you are at risk of a keto metabolic state, to where you will increase your ketones in your body a lot, but you will have low glucose. Okay. So this is an example of ketoacidosis with low glucose. Will be somebody with alcohol. The way you manage this patient is just real quick that I wanted to bring up before we start the next video. Is in an alcoholic, they will also block thiamine. Okay, they'll have a blocking of thiamine, and what happens is that our cells need thiamine as a catalyst to convert glucose into the acetyl-CoA at the very end. So we have glucose and glycolysis in our cell. Into pyruvate, which later on can yield acetyl-CoA for ATP. If you have oxygen and thiamine, this will happen. So an alcoholic also needs thiamine. Aside from giving them glucose and insulin, they will also need thiamine, because if you don't give them thiamine, they're not going to really get that much better. Okay, you're going to give them to them, you may see a small result, but you won't see the great result that they should have, because they could be thiamine deficient. Now, this will be an individual that's maybe homeless, lives on the street, or is a chronic alcoholic. You'll have thiamine depletion. If you binge drink in one night, you may not be thiamine deficient. That's to keep in mind. In the next video, we're going to continue with glycolysis to understand the metabolism of glucose in our cells. And then we'll move on to some systemic effects that elevated glucose in our blood can have on our organs.